Hi everyone. Now we are going to discuss about sterilization. First, introduction. Sterilization is an essential process in healthcare settings to prevent infections and ensure patient safety. It involves the complete destruction or removal of all microorganisms, including bacteria, viruses, fungi, and bacterial spores from medical instruments and equipments and other materials. Sterilization plays a vital role in operation theaters, laboratories, and hospitals by reducing the risk of cross infection and maintaining a sterile environment. Various methods such as steam sterilization, dry heat sterilization, gas sterilization, and radiation are used depending on the nature of the item being sterilized. Next, we are going to discuss about the definition of sterilization. Sterilization is the process of destroying or eliminating all forms of microorganisms, including bacteria, viruses, fungi, and bacterial spores from an object, surface, or substance. Next, types. Sterilization methods are broadly classified into physical methods and chemical methods. In physical methods, there is heat sterilization. The heat sterilization is divided into dry heat sterilization. In dry heat sterilization, the instruments which are commonly used are hot air oven, flaming, and incineration. In moist heat sterilization, the instruments which are most commonly used are autoclave, which is also known as steam under pressure, and intermittent steaming or tyndallization. And also radiation sterilization, it is classified into ionizing radiation, which means gamma rays and X-rays. And the second thing is non-ionizing radiation, which is the use of ultraviolet rays. Next, filtration sterilization. In filtration sterilization, there are two types of filters which are commonly used in hospitals and other healthcare settings are membrane filters and HEPA filter. The next we are going to discuss about the chemical methods of sterilization. In chemical methods of sterilization, there is gaseous sterilization, which is ethylene oxide, which is also known as ETO, and formaldehyde gas, hydrogen peroxide vapor. And the next thing is liquid chemical sterilization, which contains glutaraldehyde, peracetic acid, hydrogen peroxide. And next we are going to discuss about the objectives of sterilization. The main objectives of sterilization are to destruction of microorganisms, which means to kill or completely eliminate all forms of microbial life, including bacteria, viruses, fungi, and bacterial spores. Next thing is maintaining aseptic conditions, which means to create and preserve a sterile environment during surgical procedures, lab work, and pharmaceutical production. And the next thing is by preventing spoilage in food and pharmaceutical industries, sterilization helps increase shelf life by destroying spoilage organisms. It is also done to protect the patients and healthcare workers, to avoid hospital acquired infections and ensure overall public health safety. The next thing is prevention of infection is to reduce the risk of contamination and transmission of disease in medical, laboratory and food processing environments. And the last thing is by ensuring safety to instruments or materials to make surgical instrument dressings, culture media and other equipment safe for use. The next we are going to discuss about the advantages of sterilization. The main advantage of sterilization is to prevent infections, ensure patient safety, maintain asepsis and reduces the healthcare associated infections. The next we are going to discuss about the disadvantages of sterilization. The disadvantages of sterilization are some methods are very expensive, which means the cost of autoclave is more expensive, and also the cost of hot air oven and plasma sterilization ETO, the equipments are very expensive compared to others. In certain, the chemical may be toxic to the healthcare providers as well as patients also. And the next thing is heat sensitive items require special methods of handling the equipments. Thank you.